What does a pharmacist do? Well, most people might answer that a pharmacist dispenses the medications that my doctor prescribes. Now, I work with a ton of great pharmacists, and one thing that I don't generally see is excitement about pills in a vial. And this is probably because pharmacists have been trained to do so much more. So what can you get excited about in your community? To find out, let's go beyond the scripts. Everyone, welcome back to Beyond the Scripts. I'm your host, Will Tuft with Pioneer RX. And today, for the first time, we have three guests joining us. We're going to be talking with Kunal Vyas of RxMile, along with Daniel Valencia and John Brasiris of Medcare Infusion Services. You know, delivery is one of those things that I think a lot of pharmacies have some experience with. It's definitely a service that I feel like most pharmacies have at least considered offering if they're not currently offering. But there's really a lot of moving parts to that, and it can either be a profit center or an expense. And I'm excited to kind of dive in and get some experience firsthand from the team down at Medcare. So welcome, guys. Tell me a little bit about your pharmacy because you guys kind of have maybe a different operation than most independents.
So we're a management company. Medcare Infusion is owned by Southeastern Health Management, which owns Medcare Home Health Services. It has three basic lines, durable medical equipment, pharmaceutical, and home health. And we basically have managed care contracts. So we take HMOs and we provide service at risk. So we combine different services to facilitate the transition from the hospital setting to the home setting, and make sure that all the patient's needs are met at one endpoint. We've been doing this since the 90s, so you know we've grown a lot over the years. We're already close to 2,000 employees, and you know we keep on expanding. But at Medcare Infusion, you know we have Pioneer. We have our pharmaceutical software, and then we have our DME software. And I think one of the interesting things that we've been able to do with RxMile is, you know, create these integrations where these multiple lines can communicate, and we can centralize the deliveries. And we've grown with RxMile to over 1,000 deliveries per day, and they're all feeding into our sub SaaSes. And I have to say that a lot of our growth over the last couple of years is due to the integration with RxMile, not only at the Pioneer level, but working with them with multiple integrations. So I'm very pleased to support, you know, anything behind them, because a lot of our success stems from being able to get all these things out. You know, RxMiles, we're routing all the incontinence, the infusions, the oral, and working with them with the endpoint at Pioneer, we're able to create on top of it with algorithms to find when multiple lines are sending data to make sure that the delivery endpoint is gathered and delivered with as many of the products at one endpoint, and one delivery to reduce cost. So you know that's it's amazing. That we've been able to accomplish this with them. We've also worked on other side projects. When COVID hit, the benefit of the at-home testing, and we built a proprietary SaaS with them that we integrated, and they were the endpoint. We were able to facilitate with the APIs, deliver. We were able to have all the audit trails, the pictures of the packets arriving with the Google information to pass back if audits were requested. So, you know, we've done so much as an organization, and we continue to do a lot with them. Not only are they helping us on the delivery aspect of things, but they're helping us with the engineers with Mitch and the engineers inside of Pioneer to help with our development team. So for me, I see RxMile growing and becoming something bigger than just, you know, the delivery side, and more of a SaaS, you know, business intelligent leader in the space.
Yeah, for sure, man. That's wild. You said 1,000 deliveries per day?
Yeah.
I think any pharmacy owners out there that are hearing that are wringing their hands just at the idea of that volume. So I imagine like integrating any kind of technology into that kind of volume is quite the task. So, Kunal, welcome and thanks for joining us. RxMile is kind of a new guy in the space, and I do want to point out that this is not a like paid sponsorship ad or anything, but I really just wanted to have you guys on to share your success story and share how you're helping Medcare Infusion services specifically kind of meet that kind of crazy demand. It sounds like that kind of volume is definitely a pressure test for any kind of new technology.
We love the challenge, my brother. We love it. and I appreciate being here, Will, and also John and Danny being here. The kind words that you guys are saying, I didn't put them up to it. They're saying it out of their own mind. If they have a problem, they'll tell me. They'll pick up the phone and say, hey, you got to fix this. So, our intention obviously is continue to keep building, continue, as he's mentioned, which is not just a delivery model, right? There's a lot more to it. ROI, right, is the most important thing. When I owned a pharmacy, I knew that, delivery is a necessary evil we have to provide in order to compete with big box chains, other pharmacies out there and whatnot. So we wanted to create mechanisms and tools within our platform to create ROI from delivery. Sounds kind of crazy, right? But, another big client we have, CareMax in South Florida, they literally cut their delivery costs by 30-40% utilizing our tools. For them, they're servicing 60,000 lives. So that's a lot of money. Right now, John and them, they're pretty much managing almost 500,000 lives in South Florida right now. So these challenges are important for us, not just, in Miami where we are, because Florida, we're Floridians here. But, we're doing this all over the country. And, the efficiency of the Pioneer integration was always important. We're always looking at ways to tighten the integration for the hundreds of Pioneer clients right now that are using our platform. They're using it just like, for example, John is when Mitch said they went and did the implementation onboarding, they said this is something they've never seen before. You got 2,000 employees in there. They're running home health services, DME services, infusion services, retail services. Then they're giving some of their deliveries to our logistics company, Deliverstat in South Florida. And then they have some internal drivers that do deliveries. They do services at the home. So, all that kind of stuff is important for me to understand. So just how it's beneficial for John, it's beneficial for every other pharmacy in this country that needs to look at different revenue sources, other ancillary options to be able to bring more revenue in. Because obviously we know on the retail side, our reimbursements are, pardon my French, not that great. I wanted to use the S word, but I'm not going to do that. So we have to kind of look at different ways, and compliance, efficiencies, audit proof, those kind of things are very important for me. When I owned my pharmacy, my buddy Danny, we knew each other from before. When I owned my pharmacy, we used to process about 1,500 to 2,000 prescriptions a day. And, we were getting audited every 6 to 8 weeks because of the large amount that these PBMs were paying us with these insurance companies. And the beautiful thing about us, I was lucky because I had an uncle who owned an MSO. So when my patients received that letter, hey, use our mail order from WellCare or from Freedom or from Care Plus or Humana, it was always a phone call to, hey, look at the quality scores. Look how much I'm saving you on Part D cost versus when you're sending it to your mail order or CVS, almost $100 per member per month. So get off our ass in the sense of let us continue to manage our patients overall, including the last endpoint, which is what I call the crutch. Every doctor sees a patient, and what's the first thing they do? They go to their crutch. What is their crutch? The prescription drug that they're prescribing. And people like John and people like Danny are the ones who are executing on that. So
it's, Pioneer too. So Pioneer is going to get some credit now with their APIs and stuff. I had some bad experiences. A lot of these software companies come and they promise a lot of things on the front and it looks pretty in presentation, but it doesn't stick. It doesn't work. A lot of these other softwares. So when you're picking your SaaS provider, when you're picking your third-party app to roll into your SaaS to facilitate your operational need, it's crucial to the success of your business because you can't do it alone. We're a large company. We staff a lot of people. We have a technology division, a CTO, CIO, CAO. We're structured, but the smaller companies, they don't have the budget for that. So the good thing is when you see something like this come together where you have a larger player in this space that's able to integrate and make these things happen with RxMile and then Pioneers facilitating it, and you hear the testimony of the success, it helps, it helps the people make a decision. And that's very important to me because, it's important for me for the smaller people to be led down the right roads. It's my duty, to lead these smaller pharmacies in the right direction. And again, like you said, nobody's, this is just us all sharing our experiences. But I'm actually glad that we have a platform to do it, and that this podcast that I was, offered to speak on it, because if it helps one small business owner make the right decision to move in the correct direction, I'm going to be very, very happy. Because the direction that I went on with micro merchants, if I didn't have the financial backing for my other lines of businesses, it was a mess. I wasn't going to meet the demand at the management level to interconnect these SaaSes and everything. All these other players, if you're just a pharmacy and you're looking to break out, right? You're looking to get into DME, you need the endpoint, the delivery endpoint. If you don't have it and they can't talk to other platforms within the space, you're stuck. You're stuck in a box. And that's hard to understand, like when you just hear that. But if you're a pharmacy and you're looking to get into other lines, this is the right move.
Yeah. And, there's so many moving parts into any kind of integration. And, there's integrations that oftentimes, we face challenges with as well. But, you have obviously the technology layer, there's a staffing layer. Luckily we have some fantastic developers. We've got guys like Mitch Archer, who Kunal mentioned, who are, great problem solvers, who are, really boots on the ground. So there's a lot of layers to, any new technology integration. And then a lot of times what looks really good from an office somewhere doesn't necessarily translate to the bench. So, there's a lot of going back and improving and making revisions. Can you, Kunal, give me a basic overview? If somebody's never heard of RxMile, we've talked a little bit about how they're able to use RxMile at Medcare Infusion Services, how it's been helpful. What exactly is RxMile? Give me the elevator pitch.
Got it. So basically, as I said, I was a pharmacy owner myself. When I sold it, I decided this platform that I built to deliver to my 30,000 Medicare Advantage patients, it can be utilized not just by me. I can create my own logistics company. So I created DeliverStat, which is a logistics company in Miami. We deliver about 3,000 to 5,000 deliveries a day. Now, from there, I decided, I'm losing my hair. I don't want to do logistics all over the country. That's why I'm wearing a hat. So the software that I built, let's bifurcate it. Let's create the company called RxMile. Now, RxMile is utilized by two B2B potential clients. The first client is the pharmacy owner, just like me, who had his own drivers, just like John. And he wants to manage the operation, create his routes, assign drivers, get signature logs, consent for refills, compliance records going back in, offer patient counseling at the door. Would love to show you a demo, Will, so you can see it all, right? And from there, then we have pharmacies throughout the country that said, you know what? I don't want the headache. I really need to outsource these deliveries. So then we decided to create a vetted network of courier companies throughout the U.S. that understand what PHI stands for, understand what, that they're taking a HIPAA compliant annual exam. They're also know what temperature control climate for these medications means. They have to go through a vetting process the same way that I built my company in South Florida as a delivery company to be a part of our network. So therefore, when these pharmacies reach out to us, which every day they're reaching out to us, we have a viable option for them, not just a button that you click with some of these other platforms and some random driver shows up. Somebody who actually the pharmacy owners can speak to and communicate with. And if there's issues, have meetings with once a month and whatnot. So in this, essentially, what we want RxMile to be is we want majority, if not all, of the prescription drugs that are being delivered to these patients at their home running through our platform without us ever owning a pharmacy or hiring a driver. So we are the ecosystem. My first business was a pharmacy, which was the product. We're aggregating the product now. My second business was a logistics company, which is the distribution. We're aggregating the distribution. RxMile is the ecosystem that puts them together. And our goal is to touch every nook and cranny in this country. So therefore, we have a bigger voice. I'm talking about the independent pharmacy community. We can bring data back to bring value back to the independent pharmacy community when we're knocking on 100,000 homes every day. I tell independent pharmacies all the time, what you're doing is so valuable, but you doing in silo doesn't bring value. If it's under one umbrella and it's covering the whole country, now everybody's got to listen to what we got to say. So that's what RxMile is. I know it's a little bit more than 15 minutes, 15 elevator pitch, but
it was a long elevator ride, no problem.
The good thing about RxMile and DeliverStat is that when you're controlling, when you have your own drivers and you're overloaded, they talk to each other. So you can offload if you can't meet the demand, you can offload to DeliverStat, and a driver pops in with a route and he's already been vetted, trained.
Hybrid model.
So it's great because then you don't have the bandwidth is there. You don't internally can't do it in RxMile. DeliverStat's in the back. The driver shows up and he takes what you can't take, and you can move it around. And they all talk back to the SaaSes, and it's not just one SaaS.
So at Medcare Infusion, do you guys tell me a little bit about the products that you guys offer? Do you do a lot of retail? Do you have a storefront where customers come in, or is everything delivery? Tell me a little bit just about that product makeup and customer traffic.
So it's managed care, and it's capitated. So we negotiate with human management organizations, and in the provider network, we render the service for those products. So it's part of the ecosystem of managed care. So large MSOs in Miami have lives, and then they're directed to us, and hospital discharge planners, we're in network. So it's not retail, it's managed care. We do some retail, but not a lot of it. I'd say, it's like what, 90.
We consider a community pharmacy, but it's on a warehouse kind of building structure. So that doesn't open the doors too much for open traffic on day-to-day operations. But I'll say probably 99%. Yeah, it's
sure.
And then relationships in the community of physician direct to pharmacy. When it's PO driven, IV too, but when it's hospital, it's driven more at the discharge plan with a patient that needs an IV, he needs the hospital bed, the nurse, the full package is there. And then obviously, if it's not at the hospital level and the PCP standing, it's a one-to-one line. So it's either the hospital or the MD. But the patient is part of the MSO, who's part of the human management organization.
Gotcha. So a little bit different structure than probably a lot of our listeners, but it sounds like deliveries are definitely something that's important. Maybe this time last year you were still doing those deliveries. Obviously, you had some pain points. What did that look like before? And what pain points were you able to resolve? Utilizing RxMile.
Well, the pain points it was really hard. We had a lot of manual things going on from these different SaaSes. Because they weren't all integrated, we had drivers crossing over each other in similar areas. So that was, we're wasting tons of resources. And then getting all that information back into these SaaSes, that was very, very manual.
I think at the end of the day, what you're trying to do with applying softwares into your companies is saving time and being efficient. And that's basically where we have specialized in the last, year and a half, making sure that we're efficient and that everything that could be automated, it's automated, and then always looking for the opportunities to move that, into the technology side. Before there was a lot of issues with the deliveries, and most of them come back to time, because at the end of the day you have patients on the other side that are waiting for the medications, and if you don't give it to them on time, then you're just overpromising to all of your partners and referral sources. So time is one of the most important keys, I think, on the pharmacy side and on the delivery side as well. And basically, we're just working on a time frame to be able to execute without jeopardizing the quality of the product that you're giving, which in this case is medication, and is such an important thing for the human. So I think it comes down to being able to have that connection between time efficiency and quality.
Yeah, and if you're delivering maintenance medications to patients, I feel like maybe your time is obviously you want to make sure that those deliveries are done efficiently. But I feel like with the product mix that you guys have, maybe time is even more crucial to make sure that you're
Yes.
getting those, especially with the expense of the medication as well. Make sure that you're tracking those. So probably just a little bit higher stress level on all of those pain points for your business specifically.
And what's amazing today is that, sitting at the executive arm of Southeastern, I don't hear any operational. I used to get it all day long. We had problems with the referring physicians in. It was always, somebody complaining about something, and I don't hear any complaints, at least on this aspect of our company. It's been resolved, and we had a lot of turnover too. A lot of the management couldn't handle the stress of having to, get all that information from all these SaaSes and move all that information around, make sure it ends up in the patient's home, get it back to the directors to bill. People would just they'd burn out. It was very hard, and once we aligned ourselves and we streamlined it. Now the management that runs these departments, the logistics of getting all this out, I go in there and he doesn't have the load he had. And you see him, he's confident in what he's doing because he has control. When there's control and you can measure and audit, you have the confidence is there. When things are moving around and you can't tie them together, it's just you get a lot of pressure from a lot of different people, and you self implode. So I think we've moved. It's been, if I look back, prior to working with RxMile and DeliverStat and doing these custom integrations and getting Pioneer to talk direct and feedback and all the other stuff, it's been, what a journey, man. What a journey it's been. And 1,000 is just what we do regularly. We've had spikes, really high. 7,000 in one day.
That's wild.
Sitting at the executive arm, I've actually gone at midnight to their office, to their fulfillment, and I've seen, I brought the 7,000 packages over with my operational team in theirs, and we pushed it. We've gotten it out. It's all zones. The city's broken down. Everything's a zone. Everything's a zip code. There's a route. There's an order. A little Amazon running in there.
Well, yeah, that's the parallel I was kind of about to draw.
We got a little Amazon running here.
Yeah, we live at a time that the world has shrunk a little bit. Logistics, I think, are just so taken for granted that I can order a new watch band from the other side of the world, and who knows how many different trucks and crates and containers and everything it goes to. But, the logistic tools that are out there are, amazing. Obviously, if you have the right tools, it's going to simplify or even make possible that process. And yet, a lot of pharmacies, I feel like at that last mile are missing that technology to really, bring parity to that journey of the trip.
Yes, Will, and I tell, as you're hearing from John and Danny, we don't have a sales team at RxMile. Our sales team is our pharmacy owners that use our software, right? And when we talked about integration, not all integrations are created equal, all right? I believe in seamless integration, not bootleg integration. There's a lot of that out there. So, as long as you keep a high standard of what you're doing as a company, I think we'll go in the right direction. And, you mentioned Amazon. What was books to Amazon is prescription drugs to us. We just want to start with this, build it out, not just as a SaaS product, good top line revenue as a company, but more of a infrastructure play. That's why we're building this network of courier companies like DeliverStat is in Miami. We want that all over the country. And, it just opens up a lot more opportunities, a lot more windows to bring back a value. I always joke, I say at some point when this infrastructure is the only cost effective solution, the chains are going to be paying for the independent pharmacies deliveries. So it's a vision here that, it's happening. And I'm excited with people like John, who supported me throughout the way, has really got me in a position like this where I have big monsters like him who have supported me and and helped me grow as I have. And, like I said, these pharmacy owners are the reason why I'm here. These pharmacy owners are the reasons why I'm growing. And they're going to be the ones who reap the benefit of what we build here, not shareholders and VCs and private equity, the people who helped me build it.
Yeah. Well, what's exciting is, some of the companies that are real standouts in the pharmacy space right now are those companies or organizations even, like CPESN, who are saying our mission, our strength, our product is the strength of the independent pharmacy community working together. So I think that's something that's going to resonate with pretty much everybody who is out there feeling like they're on their own, but being able to find ways to work with other independent pharmacies to be stronger. So, Kunal, tell me a little bit about the technology itself. Like, what does this look like? If I'm in a pharmacy, I have 1,000 deliveries sitting on the shelf, they're getting ready to go out.
So I'll explain on a pioneer perspective, okay? So right now, any pioneer client is using the point of sale and scanning a prescription, okay? That's their workflow. When they scan that prescription, the receipt prints. So when we connect somebody, they're like, well, what do we got to do to make sure that this is working with RxMile? Well, I said, do the same thing. They're like, you don't have to change nothing? No. When you scan that prescription out of your point of sale, our system is already predictively putting it into our system. The label for the package is printing right there when the receipt is printing out of the system. And the other thing we do is we do a deduping process. So if Will has got another script at 2 o'clock, 3 o'clock, and 4 o'clock, it's not creating 3, 4 more orders for Will. It's taking the original order and dumping in those prescriptions within that original order. And if it's printing a label out again, it's printing the original label. So now the driver knows that, it's 4 different packages, but it's really one order for one house. Pharmacies love that because then they don't get okey doke by the driver, whether it's in-house or outsourcing, paying somebody twice to go to the same house, right? Or husband-wife combo to one house. Now, when the driver, whether it's John's driver that has internal drivers because it's a hybrid model, or whether it's a DeliverStat driver, which is our company in South Florida, when they actually complete the job, the compliance record with the signature, consent for refill, proof of delivery, image, counseling message, everything that you need for auditing purposes, which is branded with the pharmacy, goes back into Pioneer system, into the patient's profile, and closes the order out. Now, if we're doing proof of delivery of photo ID, our system will parse the photo ID, take all the data, the necessary information, bring it back into the PMS system, which is then tying into the PDMP program, eForce in Florida. So it's almost like, Will, you don't have to do nothing. You just keep doing what you're doing, and I'm making everything happen in the background, right? Now, somebody like John is actually making his own route. So he's using our route optimizer. So he's taking 500 packages, routing it, assigning 10 drivers to it, seeing what's the most efficient way so the drivers don't deliver in the same areas. He knows exactly how many miles, how many hours is going to take that driver. Every single one of those 500 patients are receiving a live tracking link so they can track their package and plan their day accordingly so they have a better patient experience. And then at that point, the driver, we made it stupid proof for them when they're doing the deliveries. Each one they're delivering, this one requires a photo ID. Can't complete the job till it's done. By the way, you're delivering to the wrong house. We have a geofencing that is telling you, hey, you might be at the wrong house when you're actually doing the delivery. So it's, again, showing a demo of it would be great so you can see it visually, but it's from A to Z doing everything. And most of our pharmacies say their call volume has gone down 70%, 80% because of the live tracking link the patients are receiving so they can plan their day accordingly. Some pharmacies say we've been able to cut labor costs now because we're not taking something and scanning it from one system, scanning a barcode, putting it in another system, taking something, docking it back into none of that. We understand Pioneer works within the firewall, so we provide 2 tools that we put within the firewall. Don't want to give too much away now because we're the only ones who are using the RX events as a delivery platform out there. Mitch has confirmed that, so we want to keep it that way. But yeah, so we want to make sure that nothing changes in the workflow for Pioneer, BestRx, DataScan, Liberty, SRX, SRS, Digital RX. We're working on frameworks. I know that we had a little thing about Prime right there, but I'm also working with them. But yes, we want to make sure that any pharmacy in this country right now is got a system that they're using that is tying in with our integration completely seamlessly, period. By the end of this year, I want to be integrated with everybody. And one thing that I do want to also mention is we have hundreds of Pioneer clients using it right now, that none of these clients are leaving their PMS once they're utilizing us, and tied in, we create a sticky factor. So that's a big value also. And, for the other people out there that do delivery modules and have delivery platforms and are in my space, I will continue to keep running to make sure I'm 5, not 15 steps ahead of you. So therefore, we are the prime option for these independent pharmacies. I tell them all the time, what you pay me for my software, it better be immaterial compared to the value I bring. And every single client I have would be able to tell you that.
That also plays out in not just RxMile doing it at the Pioneer level, but being able to connect to other SaaSes within the healthcare space through technology divisions that have the development tools to do that. Because then you're centralizing and you're going patient oriented. So that's a lot of added value. If you're thinking of expanding, if you're a small pharmacy and you're thinking of getting into other spaces within the healthcare, you're starting at the foundation to be able to do it operationally at the delivery endpoint. So I think that's a huge advantage integrating with RxMile.
Yeah, so you mentioned quite a few things, and of course I'm biased towards Pioneer a little bit, as I've been here for 13 years, but you did mention that you have integrations with lots of other software, so it's not only for Pioneer RX customers. Another thing that I think that you said was, if you had multiple delivery transactions, the RxMile app is actually smart enough to group those together. And then when you complete that one delivery, it's able to communicate with multiple transactions. Is that correct?
Correct. So that's
really cool.
So let's say we're doing an ALF delivery, or I got a driver on the road. He's doing residential and group homes. He walks into one of those. He's pulling up all 30 beds, getting one signature for them. He's closing out all 30 orders. And then the next one, he's going to a residential home and is an individual order. And the next one is a husband and wife combo. So we're looking at every single scenario there is on the delivery component. But yes, exactly. That's how it works. Yeah.
Okay. So how does that look in the pharmacy, guys? When you're getting your delivery drivers organized, I know traditionally that can be a real headache. I can only imagine with the number of drivers that you guys have. Putting those into the right bins, into the right slot, so that each driver knows what to get. What does that even look like?
And you touch on it because it's been so long since I go in there.
The drivers have their own mobile tool. And literally, I'll let Danny speak on it, but let's say he's got 500 packages. Once the routes are created, you got 10 drivers that literally open up their app, click on the mobile tool, and start scanning. And the scanner's like on steroids. It's scanning so fast. And literally, Joey stopped 2, Bobby stopped 14, Tommy stopped 13, Joey stopped 18. And they're on the road pretty fast now because they've created the inventory and the sequence numbers of their route very fast, and everybody can do it within their mobile app. Or it can be done through inventory team that does it for them through using the computer web app if they want. So there's different ways to do inventory.
So it sounds like it kind of creates a manifest and says, hey, go get these.
Yeah, the only difference that we have aside from that is that we do also have our internal drivers, and the system does give us the option of switching those packages back and forward between RxMile and DeliveryStat for internal drivers. So it kind of just deletes that final gap that we had previously. And it's just make it easy also for us for reporting purposes, because reports are going to come out in the same structure, which is another good thing that we have on the RxMile side, that the reporting is, at the end of the day, data analytics plays a huge key for upper management to be able to show results and growth and be able to track the day-to-day operations accordingly.
Nice. Yeah, that was going to be my next question, is just following up with the analytics.
Okay.
So if I'm an independent pharmacy, I feel like years ago I would offer a free delivery service because that was a way for me to get the prescription volume. Now, that prescription reimbursement has just kind of been tightened and tightened, and so you're giving away services to almost give away the product as well. So, for anybody listening out there, it could sound like, oh gosh, here's another subscription fee to add to that burden. So, what does that look like? Where are you able to, find that sweet spot where you're meeting your customers' needs and you're finding efficiency, but also, keeping some dollars there at the pharmacy?
It basically comes down to like you said, data analytics, and be able to do that on day-to-day operations. I'll say the most cost-effective right now is going to be obviously your staff payroll, utilization of supplies, and on that goes under payroll be your drivers and everybody that you could optimize to do the routes, faster. At the end of the day, it's going to bring more value to your pocket. So it comes down to that at the end of the day, and be able to provide the good service that you promise when you're making those relationships outside.
Yeah, and our scale, if I mean, you're going to pay it on the front or the back. So if you're not streamlined, right, you need more people, and when you need more people and things are messier, it's you can vertically grow. You can get to 1,000 a day. You can get to 1,200. You can do those massive 7,000, 8,000 deliveries in a day. So you can grow. So yeah, it's a subscription, but you can streamline your operation. You're bottlenecking everywhere. So it's like what I think you hit it when you said that the fee that they charge, it's reasonable, it's priced right, I feel, and it's like immaterial. It doesn't for us because we can't service the community. And if we can't service the community, we don't have a business. How much does the brand cost? How much does your brand name cost? When a doctor says, I put this delivery Medcare Infusion on an antibiotic and it needs to be there at 8 o'clock at night, and the patient just left the doctor's office at 4. And he knows that out of 100 deliveries that he sends us, at 99 will be there, that antibiotic. He's not getting that patient calling back. That doesn't happen. Now you're growing your reputation. And that's something that
and Will, I'll tell you how I combat another, because I was a pharmacy owner, right? So obviously we're working on a budget, right? We're lucky we're getting 22% after drug cost on retail, right? Now we got to work with what we have. So with me, and I'm saying this, I'm gonna look right in the camera when I say this, is every Pioneer client out there, take my software for free. Don't even give me a penny. Test drive the car. Because what happens is in 30 days, you're ready to pay me more than my tier structure tells you to pay me. Because the value it brings, they got to see it once they use it. So in that sense, that's kind of how I also do it. Smaller guys, we're talking, right? Little small mom and pops retails are doing 5 deliveries a day, 10 deliveries a day. Take it for free, play with it, use it. And then they feel bad not paying for it because of how it's valued them. So that's how I do it on my end, as far as making sure that it's easily digestible for them to understand they're paying another subscription fee. Like I said, it should be immaterial as far as the value it brings.
Yeah. So that was going to be my next question. Is there a break point where if you're doing 1,000 prescriptions a day, you're pretty clearly going to need some technology leverage? Do you think there's a break point where if I do 5 a day, yeah, I can plan those out? Now, me planning those out means I have to take a little bit of time and plan a route. Like I'm doing some of that myself. Do you see a break point where it's like at 10 a day, it makes more sense to leverage technology, or do you think it's helpful for everybody?
So there's 5 points real quick that I'll mention that whether you're doing 10 or whether you're doing 1,000, that is important for you to leverage technology. First of all is patient experience. Patient will be able to know when they're home, when the medication is coming. That's important, right? Because you want to keep that patient, which essentially is the doctor that sends you the script to make the doctor happy to continue sending more prescriptions. So that's a sales piece right there, right? Now, the other part is the audit compliance support. We got PBMs who want to make sure you dot your I's and cross your T's and everything you're doing. Oh, you're delivering? Are you offering patient counseling? Are you waiving copays? Whatever they're audited for, it's all put within our compliance record. So therefore, hey, here you go. So they're covering themselves on that. So those 3 key points I think are important. Now, in regards to the cost, the value of, let's say my lowest tier is $99 a month to use our software, right? We do have a $40 monthly integration fee we pass on to Pioneer. So therefore Pioneer and us, it's got to be a lucrative proposition for them too. People have been surprised. They're like, I can't believe people are paying 5 times or 6 times more than what we charge for our app to use yours. And what they're realizing is the value of what they're getting out of using the app. Just covering one audit that might be a chargeback might have covered your subscription for the app for the whole damn year, right? So there's so many different components. But then the beautiful part about it is, let me help you minimize your attrition rate. Let me help you maximize your retention rate. Let me help you synchronize your patients' medications so you're not delivering 1.8 per package scripts. You're delivering 3.5 per package scripts. Let me figure out a way to how to consolidate your family and maybe even your whole geographical area. So driver goes in east on Monday, west on Tuesday, right? So there's different ways that the system can help even somebody who's small doing 5-10 a day. And for somebody like that, I always tell them, just take the software and use it. And then eventually become paying customers.
Yeah, for sure.
The most valuable thing right now that I see from the RxMile perspective is Kunal being a previous owner of a pharmacy and building the software specifically for this industry, basically. As you have noticed him talking, he's well aware of everything that the pharmacy needs as far as regulation, quality, and everything that we need to have at the end of the day to be able to succeed, basically. And he's always on top of, like he mentioned, also keeping up with new things that are, being affecting the pharmacies to see if he could bring a solution to his application, which is another thing that's really good.
Yeah, we have a Ozempic pandemic right now. Everybody's taking it, right? So we're looking at different ways to include IoT sensors to provide temperature control sensors. So the patient who's not too educated because they never were taking insulin and now all of a sudden they're taking this, they're expecting it to be frozen or they're expecting it to be so cold when we know U.S. pharmacopoeia guidelines state to keep it between 59 and 86 degrees. So with that said, we're creating temperature control sensors so these pharmacies know how to react with these patients that are receiving it that aren't even educated to know that it's okay if it's not, 40 degrees, which is what they're thinking it should be. So there's different components that we look at as the ball changes. I tell people all the time, PBM is always moving the goalposts. I'm going to make sure my pharmacies can kick the field goal. So there's always different things that we have to keep, being ingenuitive on changing and updating and make our systems better as times changes too, right? So,
yeah. Well, shifting gears a little bit before we close out here, yep. Daniel and John, I wanted to kind of get your thoughts. One of the hot topics at every trade show where they have classes seems like doctor detailing and building prescriber relationships. Obviously, that's something you guys have done really well, and you're in a little bit of a different space than a retail pharmacy, but. If there is a retail pharmacy out there listening, what advice do you have as far as, reaching out and just getting your name on the mind of prescribers when they write that prescription, making sure that they think about your services?
Yeah, basically at the end of the day, what I recommend is always to not focus just on the patient, because at the end of the day, your referral source comes from the provider. And at the end of the day, if you don't give them something of value, you're not going to be able to make an impact on their panel for the patients. So anything that you could do for them that could bring them value, as far as services that you could provide them or anything, it will make an impact on that relationship, and it will make that relationship last longer.
Showing equip scores, how these guys are 5-star rated on Part B quality, reaching the 80% threshold. Those kind of things. Go show a doctor. It's a black hole when you send it to CVS, but we're actually giving a damn and taking care of making sure you reach it, right? You fill it 90-day times 3, and then the patient gets a phone call from Walgreens, hey, we're going to fill, I don't need it, I have enough. That's 9 out of 12, which is 78%, and they're failing their quality measure at that point. Medcare Infusion is not going to do that. They're going to say, let me send you a 30-day fill at least, cover you till you choose your next insurance plan in January. Now they got 10 out of 12, which is 82%. They reach their fill. Something stupid like that is what's affecting these MSOs as far as their Part D reimbursements from,
A lot of the times it comes down to education. These offices, you go in and every time they're seeing more patients, you go into the waiting rooms, they have, 30 patients per doctor per day sometimes. So they don't have time sometimes to educate the patients as well. So even education that you could provide the patients as far as, HEDIS measurements, how it affects them, if the patient has Medicare, patient's Medicare, Medicaid, and it will go into a donut hole, how the donut hole would affect the patient, in the later months of the year, and things like that, and anything that you could provide as far as from your pharmacy without having to imply the office to do extra work, then that's an extra, for them.
Yeah. So it sounds like when you're going to, have a conversation with the prescriber, instead of asking for a referral, you're offering solutions. You're telling them ways that you can help them meet their metrics, ways that you can increase patient understanding, drive adherence, all of those metrics that ultimately are affecting the prescriber's bottom line as well.
Correct.
That's the magic right there.
Yeah. Well, we're about out of time, guys. I'm going to let you guys get back to your busy days. I did want to give a shout. We didn't have a whole lot of time to dive into the backstory of RxMile. But if you are curious about that backstory, there's a couple other podcasts out there. The Business of Podcast Pharmacy with Mike Colzer, I thought was a great conversation. I really enjoyed where you guys talked about the liability aspects of delivery drivers and company structures. I thought that was a really interesting conversation. And then there's another podcast that you're actually hosting, if you want to mention that.
Yeah, The Last Mile with RxMile. We've got 3 episodes we've done with Todd Uri in the Pharmacy Podcast Network. Episode 1 is about the background of RxMile, how it came about. Episode 2 is pharmacy owners throughout the U.S. that are explaining what it's done for them. And episode 3 is my all-star team of network courier companies throughout the U.S. so pharmacies can see if they want to outsource. So, yeah, and that should be coming out tomorrow, the episode 3. And I appreciate the time to be here, Will. I've been waiting to get on this show. I guess I've finally reached a point where you've brought me on now. So, and I know my buddy Mitch has been shoving you to get me in there, and I appreciate that. And I appreciate the relationship with Pioneer, Red Sail as a whole team. And we're looking forward to continue to grow with you guys. And of course, my brother's down here in South Florida. I appreciate you guys giving me your time. I know you're running a major operation there, and you giving me 30 minutes of your time is kind of wild, but thank you for doing that. And that's all I have to say.
Yeah. And I'm glad to be here, and I'm glad to hopefully come back on and talk about the things we're doing directly with Pioneer with their APIs and how we're leveraging at the management level from the patient-oriented perspective with all these referrals and all these people, and making sure that all that information is moving and we're capturing from different people, referring patients through. So, there's a lot of interesting things that we're doing directly with Mitch right now that are going to change and elevate and take us to a new level directly with Pioneer. So I'm glad that I finally have that resource. And then I have the right SaaS supporting SEMA and Pioneer. I mean, since we migrated in, we just keep seeing our prescription. It keeps growing. The information is flowing in. It's flowing out correctly. We're getting paid. Everyone's happy. So it's, since we migrated into Pioneer, it's also Pioneer has played a big role. It's with DeliverStat in helping us, because we were with DeliverStat prior to moving to Pioneer. And when we found out that they had a direct integration with Pioneer, it was one of the reasons, we really looked at Pioneer and we moved in with you guys. And you guys are meeting all the benchmarks from the API side and business intelligence. So we're very pleased as a whole with the ecosystem of it.
I would like to also just, I know you closing up, so to thank you for just bringing us on board as Beyond the Scripts podcast. Thank you from the Medcare family to have extended the opportunity to be part of it, and also Cornell for also pushing and getting us on board here.
Thank you. I appreciate that.
All right, guys. Thank you all so much for joining, and I look forward to hearing more of those success stories down the line. Thank you for listening to this episode of Beyond the Scripts, presented by the Catalyst Pharmacy Podcast. If you enjoyed this episode, please support our channel by liking, subscribing, and clicking the notification bell so that you'll be notified anytime we post new content. To stay up to date with all of the latest independent pharmacy news and content, follow Pioneer Rx on your preferred social media platform.